afternoon. Thank you all for joining us at the end of the day. Let us know we're using a new kind of audio system. So if you have any trouble hearing us along the way, please, you can raise your hand if you're on the computer or send us a chat or feel free to just chime in. We are going to record this. I know it's kind of an end of the day thing, so I know a few people probably couldn't hop on. So we will record it and put our link on the website so that if there's anybody in your region you feel like this would be helpful information for, feel free to share it. So my name is Megan Kluth. I'm the manager of the Colorado Respite Coalition, which we're here to kind of share more information with you about today. Ellie Billman from our team is also going to be presenting this afternoon. And we've talked to a couple people in your region, and sort of the purpose for this webinar today is we wanted to share some of the resources that we have. We are a statewide program, and wanted to make sure you guys were aware of us, and then also we're hoping to learn from you. And we talked to a partner in your area earlier today, and our kind of hopeful next step from this meeting is kind of based on interest in doing this. We're really hoping to come in person to your region, either sometime later this year or early next year. And we've done this in a few areas of the state, and I've found it very, I think, beneficial for us, and it seems beneficial for partners. And really just spend part of a day together, kind of helping us understand what some of the gaps in terms of respite care and caregiver supports in your community are, us sharing some of the tools and resources that we hope we can offer to you, and just kind of figuring out how we can make sure that for us as a statewide entity, we're making sure to consider your guys' needs and factor in what's happening in your region. So that's kind of what we're hoping to do after today. So we're gonna spend the next or the first part of this webinar telling you a bit about who we are, some of the programs that we run, and a little bit of our history, and then are hoping to kind of open it up to the group and help us get a better sense of some of the challenges that you're facing in your region. We've heard a little bit already, but certainly would love to hear more, and kind of to figure out, can we keep this conversation going in a way that's really mutually beneficial. So with that, to tell you a bit about who we are the Colorado Respite Coalition. We are a statewide program, a program of Eastern Colorado. So we are in the Denver metro area, but we really try to be very conscious of remembering our statewide impact and not trying to kind of be prescriptive about what works on the Front Range, and getting out into the communities all over Colorado and making sure that we're really representing beyond just the metro area. We do also serve the full lifespan. So we serve all ages, all types of disabilities and healthcare needs, and I think that's a pretty unique kind of way to look at this. We're one of many states around the country that have a program like this. Many of us, including Colorado, got started with a federal grant program, and I think the lifespan perspective sometimes it's a new thing for people, but I think we honestly were kind of forced into it, but I think I've really grown to appreciate the power of it. And I think we've learned, certainly we understand people work in different silos and different needs and all of that, and they're all unique, but in terms of the caregiver side and the respite side, the needs are pretty much the same regardless if we are caring for a child up to an older adult. And so we found it really powerful to bring communities together and try to break down some of those, I think, naturally occurring silos that occur by age and disability and geography, and just kind of have a bigger conversation about respite and how do we keep these families healthy and supported and able to continue their caregiving. So that's a quick summary of us. Just one second. But so that being said, I think when we come to different regions, sometimes people are like, well, I work on the kids side, why are there people from the adult side? And it always takes us a little while to get comfortable with each other, but I think it's been a pretty positive way to look at it so far. So I think many of you guys are in this industry. I don't want to be preaching to the choir, but I do always, when we do presentations like this, like to kind of remember the cause of why we're here. Caregiving has been a major issue in this country for a long time, and I think it's really only going to continue to become more of one. I do this every day, and I still find it kind of shocking that it's almost 40% of Americans at some point are providing care to someone. And that could be a family member, a neighbor, a friend. And it might be like a short-term surgery up to a multi-year diagnosis, but it's almost 40% of us, and it's not something we talk about frequently or to the degree that I really believe we need to be. I'm a huge advocate of that caregiving is becoming a public health crisis in this country, and we need to find a way to make sure we're supporting caregivers and see how many ways they impact all of us throughout our lives. And another statistic that we share a lot, I think it's just, again, I see this all the time and it never ceases to surprise me, but family caregivers are providing 80% of long-term care in the country. I mean, that's crazy. That's billions of dollars a year. And so I think the core of what we do is helping people understand that not only is it as people the right thing to do to help support caregivers, but economically for our state systems, federal systems, and communities, it just makes fiscal sense to do so. So again, I don't want to be preaching to the choir. I think a lot of you are familiar with this. If you see caregivers, you've probably seen it's stressful, and it's different for everybody, but typically caregivers are fantastic at taking care of other people and not so fantastic at taking care of their own needs. And so unfortunately, I think people take on the mentality of like, oh, well, you know, at some point it'll stop or it'll slow down, and it may not. And so due to that, I mean, a lot of times caregivers end up not managing their own health and doctor's appointments and things like that and face increased risks. Depression rates, anxiety rates, those types of things are significantly higher than the non-caregivers. So there's quite a bit higher risk for all sorts of health problems, and I know we certainly see cases where those health problems are really what causes caregivers to seek resources for the first time, and that's definitely not ideal for anybody. And so a lot of what we do is just trying to get people to figure out how through us or through their own natural supports they can create a system that prevents them hopefully from kind of hitting their breaking point, or if they do hitting their breaking point, knowing where to go so that everybody is safe and cared for, and that issue can be addressed. So we know caregivers are exhausted, and the last thing they probably want to be doing is making 10 more phone calls than they already have that day. So that's sort of one area where we come in. And we, in our program, I think we have a pretty loose definition of respite. I often hear from people like, well, we're a day program, but we don't provide respite. Well, for us, kind of any time a caregiver can walk away and get some sort of break, whether that's in their home, at a day program, at something like a camp, we have a pretty loose definition of respite. And on the slide it mentions, so we're a program of Easter Seals Colorado, and sometimes people say, like, how did Easter Seals get involved with this? They know us as primarily like a disability organization, but almost all of our programs are respite, and we serve all different ages. And so as an agency, we decided to take this on and then realized it was so much bigger than just us or just the metro area, and really taken it onto a statewide program. But, I mean, essentially, respite's just some sort of opportunity for people to recharge. And I know from talking to a few people in your area, there are some options, but I think it's, like a lot of places in the state, unfortunately, really, really difficult for families to access. And so that's an issue we care a lot about, and understanding, what are some of the consistent barriers we're seeing across the state for families who may have funding for respite or may have a provider in mind, but for a variety of different barriers within the system aren't able to find it. So that's kind of where we come in and try to work with different areas to do some kind of creative problem solving, get a sense of what those gaps are, and try to get families the services they need. Okay. So I think we've kind of gone through this. I'm trying to go through this fairly quickly so that you don't have to listen to us talk the entire time, and we can get to some group conversation. But I think, we've told you a little bit about us, and we'll get more into some of the specific programs we operate. But we are almost entirely funded by state and federal funds. We work very, very closely with the Colorado Department of Human Services. We're a team of 4, so I think we're a small but very mighty team and are able to cover a lot of ground with the small size we have. And as I mentioned, part of why we're here is we've created these volunteer-led regional coalitions in different parts of the state, and really the purpose of these is bringing professionals and sometimes family caregivers together, working alongside each other with some support from us, and just continuing the conversation about respite and figuring out, is there something that we can help you guys with in terms of bringing a certain training to your community, or is there a funding challenge with respite, or just kind of getting brains together and focusing on respite. Most of our other coalitions meet like once a quarter, an hour to an hour and a half, so it's a fairly minimal commitment, but we've seen some really strong progress and I think a much more unified voice around the state on the issue. So currently we serve as the statewide entity. There's a Denver Metro group, a Southern Colorado group, which is really Colorado Springs and a little bit into Pueblo, Northern Colorado, kind of Fort Collins, over to Weld County, Western Slope with Mesa County, Durango area, and then Summit County. So we are very well aware we've got a gap on the eastern side of the state, as well as kind of the southeastern side of the state. And so each year we kind of try to talk to 1 or 2 new regions, and that is why we're here today.
So my name is Ellie Bilden, and I am the program coordinator here at the Colorado Respite Coalition, and we have a lot of different exciting projects that we work on to really address this issue of respite awareness and respite access for family caregivers across the state. One tool that I think is exponentially helpful is our management of our website, the ColoradoRespiteCoalition.org. We recently did a pretty big overhaul of our website, but it is full of a wealth of resources for family caregivers and for professionals. There's different tools surrounding, what questions to ask a provider, how to become a provider, and places for agencies to really be able to share their resources and their information to increase the access of those services to family caregivers. Within that website, we have our online resource locator. It was previously just our respite locator, but with the overhaul, we've really improved the search features on there so that folks can select the age of their loved one, the type of respite that they're seeking, their geographic area, the level of skilled care, and really filter out some different options to be able to narrow down their choices for respite services. This is a really unique tool that we have and is a great thing to be able to point families or case managers towards as your clients may be looking for respite services. It's also a really good place for agencies to list their information so that people can find them. So that is available for free on our website, and there's also information surrounding respite events, different trainings for professional and family caregivers, online resources and articles, and we are really trying to beef up the training piece to be able to have a quality and qualified workforce that's able to serve these family caregivers across the state. We also offer community grants for respite agencies. We are about to wrap up our RFP process later this afternoon, so I know that at least one of y'all on the call here did submit an application for our community grants. Those are for existing respite agencies so that they can expand their programming and increase access for family caregivers. And with that program, we accept applications from about $5,000 all the way up to $30,000 that works over a period of about September to May. And we typically administer those grants annually. So I think that's a great tool that really shows how we are trying to increase the access of respite programs for family caregivers. Another piece of our financial assistance is through our Family Respite Voucher Program, where it's essentially scholarships for family caregivers to access respite care. It's a quick 2-page application that is not income-based, but is really based around the fact that's intended to serve family caregivers as a payer of last resort. So for those that do not already receive funding for respite care services, we contract with agencies that will accept our funding and then make those payments for services directly to the agencies, so there's no out-of-pocket fees for family caregivers. We really tried to reduce a lot of barriers and folks being able to access services with this program, and we're always seeking new partner agencies to become approved providers. So if any of y'all are interested in being able to offer this financial resource to your families, please feel free to reach out, and I'd be happy to kind of dive more into what the Family Respite Voucher Program looks like. In this last year, we served over 215 families with well over 7,000 hours of respite care provided. So it's a pretty exciting program there. We also do trainings for family and professional caregivers. One is our stress busting program, where we provide tangible tools for folks to be able to cope with stress and, be able to manage the weight of the work that they're under, whether they're family caregivers or professionals that are in caring roles. And we are also always open to partnering with different agencies to be able to help support the different trainings that they're trying to put on for their community, their clients, or their staff, because we just really see that as a huge part of respite that needs to be improved across the whole state. We do a lot surrounding outreach and community awareness as far as being able to get folks in touch with the different respite opportunities that are in their area and how to be able to access respite. And we also take direct calls from families and from case managers or social workers as far as folks that have respite inquiries and are able to make referrals to them using that online respite and resource locator. With us being a statewide group, we understand that a lot of these are more macro issues, and looking at the big picture as far as statewide issues and different pieces of policy in the system that are able to be improved to further increase the use of respite in the state and the awareness that folks have that this is something that's available to them and that they should be really encouraged to use, and trying to reduce that stigma around like guilt or people not really wanting to dive into respite services. So that's just, again, kind of a quick snippet of the different programs that we have going on here. But, again, I really think that browsing through our website and checking out how we kind of have redesigned some different pieces on there can be a really good tool, at least at a starting point, whether it's for family caregivers or for professionals. Speaking of the website, you can see here that we have organized it to feature what our programs look like, and along with some different sections that focus on family caregivers and a whole section for providers. And then over here on the far right tab is where you would be able to go to our resource locator and be able to click through with guided searches to find the resources that you're looking for. A lot of our updates and changes to our website have really been guided from input from the community. So if you're on there browsing and had different suggestions or different tools that you think would be helpful to be put on there, we would absolutely love to hear that.
Yeah, and I think it's entirely likely that you will go on and look for your region and there will not be very much. I think we will readily admit that it's quite possibly the case. We try to put things on our database as much as we can and really try to kind of keep our ears to the ground to make sure we're in the loop in different regions. I'm sure we've seen some things from your region, but a lot of it kind of relies on, like, we encourage people to send us stuff. Our contact information will be at the end of the presentation. If you've got a flyer about something going on in your community or just a program brochure, or you want to make sure that your agency and your services are listed in your database, like, please send us stuff. We're making it easier for you to upload things on your end as well. But please feel free to use us as sort of a free marketing tool. We end up, the bulk of our content comes from other agencies, and so we like I said, we try to be as informed and in the know as we can be, but we are a team of four, so it's not always possible. But definitely, if you've got things that you want other people in your region to know about or other people in the state to know about, please pass it along, and we're happy to post that.
And I think that also rings true as far as social media. That's been a pretty big tool for us as well. So adding or liking or following or what have you each other on Facebook or Twitter, I think, is another good way for us to be able to help promote and advertise really some of the different things that you all may have going on in your region.
So a few other things that we are working on. One is we just did this in Denver, and we're hoping to come to it in Colorado Springs next year and then maybe expand it. But we've talked for a long time about partnering more with faith communities, and I think We spend a lot of our time kind of working with families that may be more involved in kind of the formal respite systems, but are also very aware that like sometimes natural supports are the best options for people. And I think it's really important for us to make sure that we're connecting with people that interface with these families a lot and making sure they understand where the resources exist in the community and kind of how we can collaborate. And I mentioned earlier, there's quite a few other states around the country that have similar programs that we're involved with, and we've seen a few of them do really well in partnering with faith communities around respite. And for some people, that looks like actually getting respite providers from the volunteer pools in their communities, more in the Denver metro area, but currently expanding around the state. There's a program that happens to be housed at a faith community. It's not religiously based at all, but they use the space. That's a free respite program for kids with pretty intense special needs, and they are able to match up individuals from their congregation who volunteer their time one Friday night a month, and they do about a year commitment and are able to match them up with kids and provide some free respite for families while parents get to go have Friday night to themselves. So I think direct service is certainly an option, but even just training, and I think just helping faith communities know kind of what signs of, caregivers needing help are, kind of understanding some ways to realize there probably are caregivers and people with disabilities and healthcare challenges in their congregation, even if it's not always super visible, and kind of knowing where they can point them in the community. So earlier this summer in Denver, for the first time, we hosted a faith conference and really kind of brought together professionals for representing kind of needs across the lifespan to do a bunch of different presentations with faith communities to kind of help them understand what might work well in their congregation. So we had somebody focused on dementia and what it would mean for a faith community to get more involved in the dementia community and make sure they've got the resources to at least know where to call. We did mental health, caregiving, and then children with special needs. And I think it was a really positive first event, and we hope to do it in different areas of the community. It's a super adaptable model, so like with pretty much everything we do, we don't want anybody else to be reinventing the wheel. We are more than happy to share things we've done, share templates and agendas and things like that, and kind of allow people to take it to their region to make it their own, or we can certainly work alongside you with things like that. Ellie talked about our website and some of the great updates that we've made. I think it's much more user-friendly than it ever has been. But part of that piece, and really kind of what drove that effort initially, was understanding that there's the training requirements for respite providers in Colorado are pretty vague at best, I think, in many scenarios, and not always mandated or not always clear if they are mandated what exactly that looks like or where to go for that information. And so that was something we heard across the state of people just saying, like, I really want my staff to do more trainings. I'm just not sure where to go or what this looks like or how to pay for it and all of that. And so part of this resource database, there's going to be a whole training section so that both professionals as well as families can kind of go on and find education in their community, whether it's an actual in-person training or an online course or an archived webinar or whatever it looks like. And just, certainly some of them are for cost, but I think we've been pleasantly surprised how many are offered across communities for either no cost or pretty nominal fees. And I will say one other thing that might be of interest in your area, we do have a little bit of money each year dedicated to training around professional and family caregiving. And so we do kind of, we call them grants for lack of a better term, but like small proposals if agencies are really struggling to get some type of training related to either their professional service providers or family caregivers. So if that's something that's of interest, it's kind of like an open cycle, but I can certainly feel free to reach out to me if you have questions about that. But I think, I know in talking to people in your region, and certainly this is very much a common theme all across the state, there's a really severe provider shortage, and I think there are a lot of reasons for that, and there are some reasons that are a little bit more hard to tackle than others. But it was pretty disheartening for me to hear as many providers as we did when we kind of did the survey say one of the reasons they had left or had thought about leaving was because they didn't feel well trained and like they were being put in kind of potentially dangerous situations either for themselves or their clients. And so part of this database is just that shouldn't be the gap, I don't think, in helping families as well as professionals just find the information a little bit easier, hopefully, and get people the training that they need. We're also doing, I'm really excited to say we just started a pilot of an outreach campaign around caregiving, and ultimately, hopefully, fingers crossed, later this year, it's going to be going statewide. One thing we see a lot, and I certainly hear this from providers throughout the state, is a lot of times caregivers don't identify as caregivers. They say, I'm a mother or a spouse or a sister or whatever, but not necessarily a caregiver. And we really understand that. And so we felt like there needed to be some sort of outreach and awareness campaign kind of addressing that and helping people know a little bit more where to go if they need help. I think when we first started talking about this, if you break your arm, pretty much everybody in Colorado knows go to the urgent care, call 911, whatever you need to do with a physical thing. But if you're a caregiver in crisis, or even if you just sort of wake up in the middle of the night and something flipped your whole life upside down and you became a caregiver, there's not a natural starting point for a lot of people. And so this campaign, I think, will hopefully just get more people talking about being a caregiver. We didn't put images. I should have done that, but they might actually, no, sorry, I think they are on there. But the tagline is, your care may be super, but you're only human, which I think really speaks to what probably a lot of us see with families is, it's just tough to ask for help, and getting people a little bit more comfortable, and hopefully getting people in their lives also a little bit more cognizant of hell, maybe, my mom is doing that for my dad, maybe I could help connect her with resources. And so we're really excited about that. And like I said, we're doing a pilot in Boulder and Mesa County that started this week. And we're going to kind of take the lessons learned from that to make sure that we are rolling it out in a statewide manner as effectively as possible. So it'll be coming hopefully later this year, but there's something pretty exciting going on around here. And then the last thing, Respite is an extremely complex system or series of systems in Colorado. And I think we have a very capable and intelligent team, and we get pretty stuck sometimes in the systems, and certainly no other professionals do, as well as families. And so because of just sometimes the really clunky and confusing information that comes out around certain funding streams in the state, we decided that we wanted to create a Respite Systems navigation guide that's written in layman's terms. So that is, it's kind of in the design process right now, but the content is there. So they'll be out this fall, but it looks at all different Respite funding streams. That goes through kind of eligibility and the steps you need to take to get to access Respite, through all the Medicaid waivers, through Older Americans Act funds, through veterans benefits, through our voucher program. It kind of covers as many funding sources as we could find. And we're going to print some copies, but it'll mostly be available online so that we can update it, things change so frequently. But that is a tool that's going to be completely free, and I hope, it's kind of a dense guide. I think it's 65 or 70 pages, but I think it's written in a way that people can understand. It also goes through different ways that family caregivers can help get some financial support for their caregiving roles. And my hope is that just kind of has as a tool that people can just have on their desktop and pull up when they have questions, and just kind of help families understand the complexities a little bit better. Okay, so we really are almost done, and then we want to open up to the group. I forgot to mention earlier, we are next week we start our 8th year, so we're still relatively young. But this map, I think, shows a little bit about some of our progress around the state. I have to say, I always keep this map in my office because it simultaneously is very encouraging to me, and I really feel like we see progress, but I also really like looking at the areas like your region that don't have nearly as many colors as I would like to see on them. And so, I think there's been a lot of progress, but there's a huge amount that needs to be done, and I would love to see us add some more colors and some more numbers in your area. and this is actually a little bit out of date, but this is a little bit of a summary of some of the impacts that we've had as a program. We're mostly due to our collaboration with other agencies and kind of all coming together around this issue of respite. But, I think as much as we've done, there's still so much need out there. And so we're always looking for new ways and new partners around the state to figure out how do we make sure that families, when they need respite, are able to access it. Okay, that is we tried to get through our summary as quickly as we can, so I know that was a massive amount of information. But at this point, and I know we're scheduled through 5:30, it's the end of the day for us as well, so we can kind of just talk as long as people want to. But we'd really love to open it up to group discussion. We've got kind of a smaller group here, so I think if you're on the phone, if you want to just unmute yourself, or if you're on the computer, you can use our chat box. We've got that up and can keep an eye on it. But usually the way we do this, we've done this with a few other regions, is kind of just opening up the discussion, like getting a sense of what do you have currently right now. Because sometimes it always surprises me, even people that live in the same town don't always, if they work in intellectual disabilities, they may not know what's going on in the older adult side of things, and so sometimes it's kind of a cool networking opportunity in that regard. But I think the biggest things are, what do you see as the biggest gaps? I know we were able to talk to somebody earlier today in your area about this, and I think the provider issue was a major one, and that I think is hands down the biggest one we see across the state. So there's no, simple answer to that, but I think we've got a few ideas that we can certainly talk about. But if there are any other major gaps that you see, and it's okay if it's kind of specific to your population or industry or whatever, but it's kind of helpful, I think, to start seeing some themes. And then ideas about how can we work more with people in your region, your agencies. We've, I think, in 8 years learned a lot of lessons and have been really blessed to have the flexibility to try some new things and kind of take some risks. And so we are very well aware of the fact that we're in a position to do that and want to make sure that what we're doing is serving you. And so if there are things that could potentially help you or that we could do to kind of support efforts in your region, we're really open to doing that. So that being said, I think we just kind of like to start the discussion. So if anybody has comments or responses to any of those questions, feel free to go for it.
I'll start. I'm Lorraine King, and I'm calling from Walsenburg.
Perfect.
As far as respite and caregiver support options in our area, we don't have any other than our agency. There are a few faith-based groups, but even those are being taxed by their church people and just providing services to their own congregation. And so we've tried to access the faith communities before and found that they are overwhelmed with the requests that they're getting. Being such a small area, we don't have a lot of young people staying in our area. They're leaving to relocate into more prosperous areas. And so we're finding that, of course, we have the provider shortage that everybody is having, but our caregivers are all getting older. And by older, I mean they're 60s, 70s, even 80-year-old caregivers trying to do these jobs. As far as how you all could support us in our region, I think you've been a blessing for me personally and with our program in being able to access some of your programs to provide services in our area. I think just being on your website, I'm on there quite a bit, and I'm looking at things, and I find that very helpful to us. We run a home care program with personal care providers, homemakers, and we do respite anyway, but being able to tap into some of your resources has been very helpful for us. I think our biggest problem here, in addition to the provider or lack of providers, is that our people are relatively poor. And so by accessing your grant programs, we've been able to offer some grants to them so that there's no cost to them for the respite care that they need, and that has just been very, very beneficial. But obviously, we have more people here that need care than we have funds to provide care for them. So I think resources are a big issue for us. And yes, the last one is I would love to have a meeting in person.
Perfect. Well, I'm not going to lie, we kind of have already committed ourselves to doing it because we want to come see you guys. So I'm glad that you want to see us because I think we're going to come.
Oh, great. That would be great.
Perfect. Thank you. That was a really good overview. And you're more on the older adult side, correct?
Yes, we're adults.
Perfect.
Good afternoon, everybody. This is Kidron Backus. I'm the Case Management Director at Education Field in La Junta, and I know I spoke with you guys early on the phone today, but it sounds like Ray is on the phone, so just to kind of share with her, we're a CCD, so we provide services through all ages of life, and there's multiple different HCDS waivers that people access respite care through the IDD HCDS waivers. And I shared with Megan and her team this morning, really, a lot of our problem is just finding providers to do respite specifically for our children's extensive support program. And some of the challenges of finding respite providers are that they can't meet minimum either education requirements, or they can't pass a background check, or they can't pass a drug screening, that sort of thing. And so it's coming to provide those respite services. So that's one of the largest barriers that we have, is just finding people to employ to do the respite for those programs. So, and I know we have a lengthy discussion this morning, so I don't want to get into all of that, but I thought I'd share that with everybody else that was on the phone.
Yeah, no, I appreciate that. I think, Katrina and us had a really helpful discussion this morning, but I think those are very real issues in terms of providers. And, just sort of one of my very quick thoughts is, I think especially in rural areas, we've had some conversations with other regional groups about, like, is there a way to kind of, I think everybody's short of providers, so this isn't always a feasible idea, but if there is one agency that somehow kind of found a pool of, whether it's volunteer or professional providers, kind of like that might be able to fill in some gaps periodically with other groups. I think that's one of the other positives of kind of looking at this from a lifespan perspective and breaking down those silos, because certainly there are some cases where it makes perfect sense for somebody to stay caring for only one pretty specific population, but I think there are a lot of families that might have slightly more, not quite as high of a specialized need, and there could be kind of more of like a community provider pool.
Yeah. I think that that's a really, really great idea. Knowing some of the plans internally for our agency and some of our strategic planning and what our future looks like as a service provider, I think that Inspiration Builds might be able to kind of lead in doing that. If there was a known need in our region for respite, and it was guaranteed that we would, we couldn't hire a pool of employees. Mm-hmm. If there wasn't services guaranteed that needed to happen, if that makes sense. So, but I know where a lot of our strategic planning is, and I think that it fits in with some of the strategic planning that we have for our agency. If you guys were able to give us data for the region, and it's just, we're service providers for all of the HCDS waivers. We have an early intervention program and a family support program. So if we had members of the region that accommodate maybe kiddos or people in SLS or whatever that needed respite services, that they're maybe approved for those respite services that can't get them because there's a provider shortage. You know, if we had that kind of data, we would be able to sit down at the table, I think, and Inspiration Field might be able to be that community partner that had a full respite provider potentially.
Yeah, absolutely. I think, and that's something I think we've kind of done with some other areas, is just usually kind of what we do early on with this. And I think at this point, you know, when we come down, not if we come down, we do kind of breakout sessions and ask kind of everybody to, like, we make a grand list of all the different resources available in the community, even if they're a little bit kind of out of the box. And then type all that up and share it with people, and then kind of build it as we go and build kind of a contact list and try to get some of these things together. Because, yeah, I think a lot of times it's like there's just lack of information or connection. And so I think that in itself could be a really good tool. But, no, I mean, I think it wouldn't necessarily be like a super easy thing to do something like that, but it definitely could be one sort of option. I know I was shared earlier with Kidron that we are hosting a training. It is going to be in Denver, but it'll be open to people across the state in October. That's a 2-day provider training, specifically like hands-on training to become a respite provider. So it's going to be fairly small, but I think we're kind of saying if potentially one person from different organizations or regions could go if they're interested. And we're working on a flyer right now, so I'll send it out once we have it. But it's a evidence-based national model that has not been super active in Colorado, and we're excited to bring it back. And I know some people are going to come up from Colorado Springs to do it. But I think, you know, things like that are areas where we can come in and, you know, we're dealing with the provider issue up here as well, and it's rough, and I wish there was a good answer for it. I have not found that yet, but I think doing things like trying to entice more people that maybe haven't been traditionally considered for more like full-time respite, but could do things part-time or more on a volunteer basis, and just looking at it from a little bit different lens than I think a lot of us have traditionally. It's sort of one of our strategies, but yeah, those are the types of things we could definitely talk about in person.
Yeah, and I know you guys said that you're involved in state-level stakeholder meetings, and you know, when we talk about respite services and the amount of reimbursement, and I know that that's a barrier that other people have said too, you know, the reimbursement fees are not that great, and so that's an additional barrier as far as employment. And you know, we're just months away from minimum wage increasing again.
Right.
And why would anybody want to be the respite provider getting paid the same minimum wage as, you know, working at Walmart or McDonald's and not having the talent of providing respite services? And, you know, I think that, you know, the more voices that we have, you know, at a state and federal level saying it is not enough money to pay for skilled respite or, you know, services in general. You know, we can't even, because the laws passed in Colorado for minimum wage increase until in the next couple of years, it's going to be ever more cumbersome to even be competitive with minimum wage, let alone try to be over minimum wage, so that it's more enticing for people to provide those services. So the more people we have really preaching that message, I think the better it is.
Yeah, absolutely. And I think the provider issue and the reimbursement issue, those are consistently what I see as the two biggest problems around the state. And I think those, regardless of your funding source, if you're on Medicaid or not, like those across the board. And so those are, I mean, both of those are like absolutely top of mind for us, and trying to figure out, I mean, yeah, there's a lot of discussion going on the statewide level around the reimbursement rates. There are certainly things we've been part of. But yeah, I think there are some areas for some kind of systemic improvement, but I think, you know, this issue is just going to keep growing, and I think, especially on the older adult side of things, I mean, it's on everybody's side of things. I think on the older adult side of things and the aging caregiver, I mean, those numbers are going to just keep shooting up, and we have to I think we have to keep pushing for the change in the system that we see as needed, but also think of ways that maybe we haven't tried before, or just partner in ways we haven't before, and I really think it has to be a combined effort.
Yeah.
Does anybody else have any thoughts on gaps or just general respite thoughts in your area?
This is Kimberly Montejano. I'm the Director of Nursing at Nursing Care Center, a long-term care center here in AVRMC. And although we are at capacity, I know that they have talked in the past about having a respite room. I know some of the nursing homes have respite care. However, there's a new nursing home to be built that they're in the process, and I think that might be an area to explore to make sure that maybe that be a consideration.
Yeah.
I agree. I have 70-year-olds taking care of their parents who are in their 90s. We continually get phone calls from the acute care side saying, this is the third hospitalization, they just need a break, and so they can regroup and be better when they're home, and they're older and older. Not even the sandwich generation, I think triple-decker situation. They've got grandkids at home, they're helping their kids, and then they have parents, and they're retirement age or above. And so there's a lot of multi-generational situations. And so I think that for La Junta, for Otero County, I think that probably needs to be something that would be brought up to that committee, the health district, to really consider short-term placements in their new nursing home.
Yeah, I think that's a great idea. And are there age limitations on that? Or, we definitely see kind of a pretty open-ended look at facilities like that for respite in other areas of the state. But.
I, to be honest, am not the best person to say that. I would assume because they're adult facilities, they would have to be adult with either special needs or medical needs, that sort of thing.
Sure. No, I think it's still a really creative solution, and there may be, I think that kind of tends to be like a backup plan for us a lot of times when we get adult calls and are not quite able to find another placement. And I certainly understand it's not always ideal if you're 25 to be going into that setting, but I think if there was a way as a community to create kind of an appropriate type program to meet those families' needs, especially when it is like an overnight or a crisis, I think it's a really good use of space.
Yep, it's a safe place, and they're usually, trained staff and that sort of thing. I think it would be a good idea for that to be incorporated in whatever plan they have.
Absolutely.
Even if it's respite strictly for a geriatric population, for somebody who, needs a weekend away with their spouse and needs to be placed for mom and doesn't want somebody in their house, really, and that sort of thing.
Yeah, absolutely. I think that we've also seen at least a few different long-term care facilities and assisted living facilities that operate day programs that are pretty successful. And again, just being able to kind of capitalize on having that space available and that trained staff that is already doing these types of programming anyways. So I think that that's definitely a great route to explore, and that would be, other good partners to be able to have at the table as well.
Absolutely. And I think it's interesting how I think people have come up with really creative ideas about mixing space across different generations and populations. I know we've got another region that we work with that has kind of an adult day center, and one of the kids providers was talking about, you've got the space and it might be built for adults, but could we do a drop-in more kids and teens program after school and things like that. So I think there are kind of creative ways to do it, or definitely there's people that have looked at doing more of the intergenerational thing. I think money and time are always the major barriers, and we are able to help a little bit in both of those regards at times, and certainly are willing to have those conversations with you all. But I think, I think it's just the power of creative thinking with this pretty big, and so we would definitely love to come down at some point. We'll kind of take a look at our schedules and figure out the best time and make sure it's out in advance, and so that we can kind of share it with you, and then definitely encourage you to kind of share as we get further in, like, contacts in your area. Even if you, like, are not sure if they're a good fit, I think there's so much commonality in this issue that the more people we can get to the table really having this conversation. I think a couple of you kind of, made a note that we just have to keep talking about this. And I think that things like your community group talking about this long-term care facility, I think more conversations like that and just getting people to have respite a bit more on their radar and understanding the need is huge. So we would definitely love to come down your way and kind of do this in a more formal setting. We typically do it, for part of a day and really do a lot of breakout groups and kind of understand, make an assessment, like I said, an inventory of what is available in your community, figure out who's missing from the table, because there always are people missing from the table. We've had groups from more facilities to people that might not provide direct service but do a lot of case management. School districts have been involved in some of our regions, faith communities, hospitals, kind of anybody like that. I think that might have some sort of vested interest in respite and caregiving is more than welcome, as well as families. I think sometimes some of the best meetings we've had have been kind of led by a family caregiver, and sometimes it's really helpful to hear from their perspective what they really want to see, or sometimes I think in rural communities, I do think you guys do a much better job of being aware of those needs, sometimes more than us up in the urban areas. But, I've been in a couple of these meetings where a professional thought they had a great idea and a family was like, here's 10 reasons that wouldn't work for my family. So I think the more we can get providers and families in the same room having this conversation, I think we can come up with hopefully some effective solutions. Well, we're more than happy to keep chatting about respite, but I know we're scheduled till 5:30, but I am aware that it is kind of the end of the day, so I don't want to force anybody to stay at their desk longer than they need to. But certainly are welcome to keep the conversation going. But kind of, I think in the meantime, while we're figuring out what the timing is for this in-person meeting, just keep us in mind. If you haven't used our website in the past, please do. I'm really glad to hear at least one of you has. Send us questions, or if you have, to be really, really honest, we may not be as helpful as I'd like to be right now in terms of helping out in your area, but I think we need to kind of know what some of the challenges are, and there may be times that a lot of times we get people that call us when they're kind of are at a loss in terms of what to do with a family, then they're really struggling with a referral. Feel free to bring this in. Generally, if we don't know the answer, we have some ideas of who else you could go to. So please feel free to do that, and please check and see if your agency is on our resource list, and especially if you are a respite provider, and if not, it's pretty easy to add yourselves. We would love to kind of beef up some of the material and resources in your area on our website. And then if you can just kind of keep us in the loop, like generally we really try to take on the bulk of the work, because I know you are all extremely busy people, and we don't want this to be a burden on anyone. So if you've got people, even if you just shoot us a quick email and say, hey, can you just add this person to the mailing list? I think they need to be involved. We are happy to go from there. But please just share anything that you feel like we need to know. And then, yeah, I guess we will just plan to see you either later this year or early next year. We will, I think we've got Lorraine and Kadron, I know about your email addresses. Kimberly, are you on a computer and able to put your email in our chat?
Sure. Yes.
Perfect. So we will, so what we'll do is we'll send you the recording of this webinar too, so if there's anybody that you feel like might benefit from hearing about this, we can send it over by email in the next couple of days. And then this is my contact information, and I can also, when I send out the presentation, I'll make sure to put Ellie's as well, so you have both of our contact information. and then we will just sort of be in touch with you. I think the last week of August is a little crazy for us, so I think in September we will kind of look at calendars and try to nail down a month for us to come, kind of keeping weather as a consideration. And then, like I said, we'll make sure it's giving you plenty of notice to promote it. We'll put a flyer together and all of that. If anybody has a meeting space, I know it will be much easier when we have a date, but that is usually super helpful for us if you can kind of help in that regard. But other than that, we will kind of hopefully take it from here and see you guys in a few months.
Thank you.
Thank
you. Sounds good.
Yeah, thank you all. Thank you for your time, and we really look forward to coming to your area.
Thank you. Have a good day.
You as well. Y'all take care.
Thank you.